All right, you're welcome back. Incessant strikes and controversies in the health sector are some issues that have featured prominently during President Buhari's 3 years in office. Experts in this sector are optimistic that the challenges can be overcome if the present 2018 budget, which includes the 1% Consolidated Revenue Fund, is signed by the president.
Well, TVC's health correspondent Kemi Balogun highlights the setbacks and achievements of the health sector in the past year.
It has been a challenging year for the Nigerian health sector, but while there have been setbacks, there has also been some notable gains. The past 3 years have witnessed achievements such as the launch of the universal health coverage and the revamping of primary healthcare centers across the country. These two strides were on the front burner of moves to improve the healthcare sector. Experts and Nigerians alike are quick to give their verdicts on how the healthcare system has fared under the watch of the present administration.
For us to really assess the health sector, we need to look at different aspects. You know, we can't just give it a blanket review. And by different aspects, let me start from the things that we think have worked in Buhari's administration under the health sector. We think that when he appointed, for the first time changed the heads of different public health agencies in the health sector in 2016. We felt that that was something that was good. And from that action itself, we've seen how the purview under the different heads of public health agencies have changed over the years. But in one area we think, the administration has been a bit aloof is when it comes to strikes in the health sector. The current Johesu strike has been going on for 40 days. What that means is that, the hospitals, public hospitals have not been working optimally. People have been dying. And it seems as if the president is not perturbed about it.
The reinstatement of Usman Yusuf, the NHIS boss, after his suspension by the Minister of Health in February, caused an uproar in the sector for some weeks, while the ongoing strike by members of the Joint Health Sector Union is viewed as a critical setback. Many slammed the administration for not handling these situations properly. One major gain for all those advocating for more funding in the healthcare sector is the approval of the 1% Consolidated Revenue Fund for the basic healthcare provision in the 2018 appropriation budget. Experts believe this could help to be one step closer to achieving proper healthcare for Nigerians. Minister of Health Professor Isaac Adewale unveiled the Buhari's administration plan to revitalize the country's primary healthcare system, but his achievements in this remain shaky. To achieve optimal effect, the healthcare sector needs a lot more attention, bearing in mind that healthy Nigerians will help the economy thrive. Kemi Balogun, TVC News, Abuja.
All right, Kemi Balogun's report there. Very dismal outlook, it seems, from that report. All right, with us in the studio is the immediate past chairman, Nigeria Medical Association, Lagos State Branch. Actually, what I have is Medical Guild, as chairman Medical Guild.
Yes.
Of course, in the person of Dr. Said Babajide. Good morning and thanks for joining us.
Good morning. Also,
Oseni Olugbenga Saliu is immediate past chairman Medical Guild, right here in Lagos.
Morning.
Good morning, gentlemen.
Good morning.
It's good to see you. Would it still be proper to say, well, happy Democracy Day? Is there anything to celebrate as far as the health sector in Nigeria is concerned? According to the World Health Organization, a report that came out not too long ago in 2014, Nigeria lacks a serious approach to healthcare. Would you say really what's been going on in that sector is a true reflection of what the World Health Organization has said?
We think Nigeria, the problem of health in Nigeria is multifactorial. Because the problem we have, the people that manage the health sector in Nigeria, they don't have the knowledge, the skill, and ability to look at what the health organization is talking about. In health, you have what we call health auditing. When you have health auditing, there are 3 parameters about health auditing. You have the institution, we have the consumer, and we have the provider.
Okay.
The 3 have to go pari passu. When you say institution, you are talking about the structure. You can be building different structures, but when you don't have the provider, the enough in terms of provider, the health workers, in terms of the number, in terms of the quality, in terms of the remuneration. The third one is the consumer, which are the patient, which are the populace.
Yes.
But the problem we have in this country is that you increase the institution, you build more hospitals, more clinic, the population is increasing. That's we are talking about the consumer.
Yes.
But the number of the provider either reduced because people are leaving.
It's diminishing.
Doctors are going.
And more
Health
recently,
workers are going, but they are going.
There were reports that Nigerian doctors are flying overseas now to see greener pastures.
Yes,
absolutely.
when such thing, that one is reducing. Therefore, you can't have optimal health delivery in the country because you have to make sure that all these three parameters are moving all together. Because the other one, the population increase, you can't do anything about it. The only two you can do,
that you have control over.
You have control over is the institution. You build more hospitals. In terms of building hospitals, not just building hospital, you have to equip it very well. Our president should not go outside. If our hospital is equipped very well, look at what the wife of the president said about Aso Rock.
Aso Rock Clinic.
It's not only Aso Rock. Down the lane to the level of the local government.
So if Aso Rock's medical facility could be in that state, then you wonder what would happen
at the other level. That is the problem. Now after that, you now talk about the provider. You talk about the remuneration. Nobody talk about only about the money. What about training? Training and retraining. Yes. How many people are being trained? What do you want to get? If you are not training them, if you are not giving them enough good environment for them to operate, our health indices will be in shadow.
All right, let me bring in Dr. Oseni Saliu at this point. Well, she talked about the United Nations report indicating that Nigeria does not have perhaps real focus in terms of the health sector. You remember very clearly that we used to have multi-year plannings, from independence until the mid-80s. I think it was the overthrow of the Babangida, I beg your pardon, Idi Amin regime that ultimately put an end to those kinds of plannings. Isn't it?
The 5-year, 10-year development plans?
Absolutely. Isn't this an indication that we are lacking, thinkers within governance space?
Well, the reality here is that, just like he has said, the provider is of paramount importance in the center of the whole stuff. That's why Olikoye then has focused so much on the primary health care.
Yeah, former
but
health
today
minister.
we don't really have a functioning, well-functioning primary health care. In fact, what we have now is facilities that are available, but no proper manpower to manage it. So once you have the structures there, you don't have people that can provide the services, there is just a waste. We need to look at how much of the public we are attending to. How much of the public are really benefiting from what we build. Yes, you can have a very fantastic structure. You don't have a SFIG in a hospital, you don't have a doctor in the hospital. The structure is useless. We have
just like the one Bayelsa State government Governor Seraki Dixon has built.
Yeah, we had a situation where some doctors had accident 2 years ago. They got to the facility, there was nothing to provide, not even IV fluid. You understand? In those days, we have even a center like General Hospital in Ikeja used to even compound its own IV fluid. Wow. Today, ordinary sanitizer we import from outside the country because we don't have proper planning. We shouldn't be importing paracetamol when we have so many pharmacists. We shouldn't be importing spirit sanitizer when we have so much people that can provide it.
So can we trace it back really and say this is where we began to get it wrong, and hopefully we can begin to fix it from that point? Yeah. Well, how did we get it wrong? Because if you say that General Hospital Lagos before could actually compound their own IV fluid and all of that, what happened? What went wrong?
Where we get it wrong, everybody know, the military inclusion in the system. Because if you know, when the military came in, their priority is defense. Look at the budget, except the budget is changing now. They put more high percentage, high fund on budget, on defense. Therefore, affecting education, also affecting the health in terms of the budgetary allocation. For example, if the Nigeria, since the time I know from military till now, we have not gotten up to 5% of budgetary allocation on health. Now, what do you expect from
5%
yes.
was just in 2012.
2012.
Yeah.
That was the highest.
Yeah.
That was the highest. Because at that time, they were thinking of, oh, cool, somebody want to overthrow them. That's why we have all this decaying in the health sector. And the best way to fix it is for us, is for the government, because you have to have not only declaration of state of emergency education, there should be total declaration of state of emergency in all aspects of life in this country. We must sit down, look at what are you going to do, what is percentage you are going to give the health, what percentage you are going to give the education. And from the local government up to the federal government, let's have a plan. Not that somebody will come today, if it's APC in government, you abandon that project and come with another one. Let's call the technocrats. Let's leave the politics away. There are some essential things that we must leave politics. Education, health, you must remove politics. We sit down, we look at it, we have about 10 or 20 years projection. If anybody government comes in, you follow it up. This country will be better for it.
Then it's important. It's also important that we should monitor the use of fund. Yeah. Because that's really where the problem is. Yes, funds are allocated for particular activities, but nobody is really monitoring it. So the funds are not really used for what they're budgeted for. Yeah. And eventually you don't have any results.
Yeah, and what is said about percentage, and as I also reminisced earlier, we've only had the highest percentage of 5 in 2012. And if you remember very clearly, in 2001, there was a meeting of African heads of state in Abuja where they came up with the Abuja Declaration, all right, and where it was agreed that all the nations would budget 15% of their annual spendings on health. But
that's
unfortunately,
minimum.
That's
minimum
And
percentage.
what does it say that since then we have not been able to even get close to half of it?
Well, I think the reality is that the will is not there. Once there's the will, it should be done. Because health and education is primary factor that affect everybody. Rich, poor, local, in the town, and all those stuff. So if we have the will to do it, I think we'll be able to do it.
And no proper prioritization of that.
Yes. So when you have the will, that's when you prioritize. So it is important government should pay attention to this. Then that is where training, retraining, and allowing the people that are trained in those parts to make use of their knowledge. Because if you train somebody to
so it's one thing to train,
it's one thing to train, another thing to allow somebody to
provide the skills,
to use the capacity.
A lot of Nigerians that go outside the world are performing fantastically well because the environment is suitable. But if you are here and, in fact, by the time you make a demand, somebody is saying, oh, your demand is too much. Look, you are creating a problem for us.
Speaking of which, that brings me to what is going on right now. One of the major challenges in the health sector has been cited as the inter and intra professional discontent in the system, in the healthcare system, or in the healthcare sector, if you like. Johesu is on strike now. It's about 40 days or so that it's been on strike. It's not the first strike that they've embarked upon, and yet their demands have not been met. You have the NMA, on the other hand, who has been breathing down the neck of the government, saying, don't even think of acceding to the demands of the Johesu. So it's a clear testament of the kind of clashes that you have within a sector that actually really should be united. Help us make sense of that and exactly what is going on, because Johesu, on the one hand, is saying, look, we're not saying we must or we should earn the same thing as the doctors are earning, but we want equity. We want the same justice that you give to the NMA, to be given to Johesu.
Yes, you see, the problem of the Johesu now, the strike, is that it's unfortunate that we find ourselves in this sort of situation. The last government of Goodluck Jonathan, because of this problem, set up a committee. It was even initiated by the Johesu, that doctors have dominated everywhere. And the president set up a presidential committee on interrelationship in the public health sector, headed by the Yahya Ahmed. Okay. They went with Johesu. Not only with they went to many countries, Brazil, all these countries, and know what is the best international best practice. they now came up with solution, recommendation. That recommendation had been submitted in 2014. That recommendation will solve this problem temporarily. Not that the problem is perfect. There's nothing that is perfect.
Yeah.
But it will solve this problem if government have brought out this recommendation.
What
are
some
the
of
recommendations?
the recommendations? Yeah.
In terms of relativity, the relativity must be maintained. What we mean by relativity and parity is this. For example, I normally use the media house. Sorry for the cameraman. Cameramen cannot take the same amount of money with a broadcaster or journalist. It depends on, relativity depends on 3 things. One, your level of education. 2, your input. 3, the risk. Type of education. Doctor went through 6 years, not just 6 years, 22 semesters. What is 22 semesters?
Yes.
The first year is the normal 2 semesters. The remaining 5 years, you spend all your life, all your 365 days in the university and the hospital. And each year make 4. If you add everything together, you have 22. But BSc holder has 8 semesters. If you want to the level of the PhD is 20 semesters. Now, that is why in a developed country, they don't give doctor BSc, they give them MD. MD means doctor of medicine.
Yeah.
The same thing as PhD, doctor of philosophy. That's the term of your education. In terms of your input, what do you bring to the system?
Yeah.
To be frank and sincere with ourselves, 70% of input to the care of patients is from doctor. Because they are the ones that are going to see patients in the clinic. They are the ones that are going to do the ward run. They are going to go to the theater. They are going to solve the problem of the other people. We give respect to them because they are assisting. We cannot do it alone. What, in terms of your skill, you put more of your skill there, that's your input. Talk about risk. Risk in 2 ways. We have the legal risk, we have the health risk.
Yes.
If there's any outbreak, epidemic, look at the statistics.
Like it happened in the Ebola outbreak in Nigeria.
It's the doctor, followed by the nurses. That's the risk. In terms of legal, if something happened to the patient, who they sue? It's the doctor. That we are saying that the relativity must be maintained. And unfortunately, from 1960 to 1998, that relativity have been there. If everybody should know, when during the colonial period, when Governor General is not around, the next person is the most senior doctor that take over. That's how level we are at that time. Because of this now be eroded till that time. From what now happened? In 2009, NMA called for review of the salary. Because GSU did not do anything at that time. And what now happened? Government acceded to it. The GSU just took the table and took it to the government that they also want. You know, government can do anything. They just duplicate what they have been given to NMA and become what? COES. We now sat down in 2010 and look at this. That we did parity. In parity, normally, the parity started from 3 to 1. There's a 3-1.
Yeah.
Now, it got to the level of 1-1. We now look at, no, this parity. Do negotiation. We now ask. They say, no problem. Let's make it 1.6 to 1. We now agree. 25 years of area. We say, no, let's forget about 25 years of area. And now agree with that comment.
And make progress.
And
go forward.
and listen.
Okay.
It's not salary increment. It's a correction. People don't understand it's a correction. What do you mean by correction is this? Out of the 5 or 6 parameters in your salary, only 2 parameters were changed. The basic consolidation and your core duty. Because your core duty depends on your basic.
That is
why now that's why people don't understand it.
In that of Johesu?
No, of commerce.
Of the commerce. Okay.
From that, after they have sorted out the issue of commerce in 2014, it took some 2 or 3 years before that corrected commerce. Now,
is there another word that can be used for commerce in a way that the ordinary man on the street can understand what exactly you mean by
consolidated medical salary scale?
Okay.
You know that Obasanjo consolidate all the salary. why the quest is the consolidated health salary scale.
Salary.
After we have done that one, the US now came and now told government, what we are giving doctor, you must give us the same thing. At least this time around, we have...
Is that really what they asked for?
What
or they're saying, or
no,
what they're saying
no,
is
what they're asking
the
for,
gap,
no,
the disparity is too
listen,
wide.
What they are asking for initially
Yes.
is that they went to the minister and said, this is what we want. Minister said it cannot be, it can't be. They now said they want it reduced. It's a simple thing. As I said, a producer in a media house collecting 10 naira and a floor or a cameraman collecting 5 naira. You now say, increase my 5 naira to 7 naira. Are you saying that person, the 10 naira, should still wait to that 10 naira? By the time you increase somebody from 5 to 7, naturally,
the person with 10 naira will ask for
equity
more.
should also be more. That's why we are telling government that if you increase it,
increase ours too.
Actually, NMA is not actually saying they should not increase their salary. What we're saying is their salary is not independent of the salary of doctors. Just like he said, when we fought for the consolidated medical salary scale, as soon as it was adopted, by the time US was going to go on strike, they just presented what we had, the same for them. And government, because it doesn't want them to go on strike, adopted it and started giving it to them. In fact, there are some nomenclature in their salary scale that were abnormal.
In other words, they're saying that government was blackmailed into accepting.
Exactly, which is what they're trying to do. That's what I'm
but Johesu makes up 95% of the health care system. Am I wrong? Or
well, even
that's not true.
That's not true. But even if that is the case, the pilot is just...
How vital is their role to the overall health sector?
You see,
how vital?
We said everybody is important. But how important you are, it depends on your input. What we are saying is that with due respect to them, a patient can come to hospital and not see anybody. If a patient comes to me and the person doesn't have any problem, I give the person, they don't give reassurance. He goes home. A patient can come to hospital, see nurse and not see a pharmacy and buy drug. A patient can come to hospital, see the pharmacy. It's not necessary. He must see another person. But they also have vital role. But everybody will understand that when you come to hospital, like for example, when our president was in London, people are asking him, why are you coming back? Look at the word he used. Until when my doctor certify me. He doesn't say that there are no other people did not treat him. But when my doctor certified me. When he came back recently, what they say? He said, I went to see my doctor. It doesn't mean that other medical people are not important. But people understand how important. And again, from immemorial, the health started by doctor, but now call other people like Nightingale
He actually trained
just
them.
to assist in the treatment.
All right, we have been talking about a funding challenge of the health sector. The National Assembly, of course, talked about the 1%, added the 1% consolidated fund. Is there a way you think that this will also help? Because we have been talking about the shortage in funding the health sector, and in the budget, I think it's just about 300 and something billion thereabout, which falls short of what is needed to fund the health sector. Is there a way that would also help?
Yes, definitely it will help. Actually, everybody has been talking about universal health coverage. You understand? The insurance and all the other community-based approach to ensure people's health, that will be up for them. Like Lagos State is trying to start a sort of insurance system. That 1% is part of what they're planning to use in implementation. You understand? Though we still have a token from the participant as contributory, but that will be a bulk of money available to implement. So the universal health coverage is actually the way to go. So that everybody can have their service. Though there are still some issues around it, but that can be properly managed if the right set of people are allowed to implement it.
Are you on the same page as well?
Yeah.
Yes. You see, I think we are happy this time around. The person that even gave the information during the ADM, annual delegate meeting of the NMA that we had in Abuja last month, when the Senate president said that they are going to sign, you have to have 10%. Vice President was there, he said he'd be happy if he signed. That means that the two of them, executive and the legislature, they are there. It not depend on them to do what they're supposed to do. Like he said, we should go to NHIS.
Yes.
From that NHIS, you don't have what? universal
coverage
for everybody. All these things will reduce. Poor will gain from it. The rich will gain from it. You don't need to move out of the country. But unfortunately, the political will, is it there? Can they do it the time of election? Can they do it the time of election when they put money for election?
That's another matter entirely. But then again, is it just a question of political will or the understanding of how important really this
the understanding will come in when you use the right set of
Okay, let's even look at some of the promises made by this administration when it came on board to fix the health sector. 10,000 health care centers to be provided in 774 local government areas. Are you able to say that government has been able to keep that promise so far?
We all know the answer now.
No, I don't know the answer. That's what I'm asking.
To be frank, I said I don't do anything. The way I see like Buhari, they have not done anything about it. You see, you must understand, I still give respect to Professor Olukoya Irason-Kote. When you were the minister, if you employ me as a, you told them head of state before he got the employment, let me do what I want to do. If you don't allow me, I'll get out.
Exactly.
That's the will. I have a plan. Mr. President, this is what I want to do. If you don't want it,
put the right person there.
Because the most important thing is preventive more than the cure.
And that happens at the primary
yes, primary health care.
In Lasut, in Lut, there's some cases that doesn't have to go there.
Yeah.
They have to be what? Seen in the primary. If primary health care is functioning, we don't have complication of malaria. That will reduce. You know, see people having sick leave, not going to work. Because at that time, they will have stopped it at level. But the clinic is nearer to your house. You don't need to travel or because of all transport problem.
And you know, Dr. Femi, we do not have time anymore. There was a report that indicated that we would need about something in the region of 790 billion naira to meet up the Abuja declaration. But the question is, will we ever
meet that, or even be anywhere near?
Just like I said, the will. If we really want to do it, we can. The fund is there. I don't accept.
So is it an attitude? Is it an attitude?
It's because the will is not there. Because
what will it take to bring back so many doctors that have left the shores of this country? You have 70% of black doctors in the US, for example, are Nigerians.
Improve welfare package. Provide a good environment for practice, and people will come back.
And again,
enable environment.
And again, you should respect the doctor for what they are doing.
If
you don't respect them, people got.
All right, Dr. Oseni Saliu, immediate past chairman, Medical Guild, Lagos. Thank you very much indeed for coming.
Thank you very much.
And Dr. Said Babajide, also chairman, is the current chairman, Medical Guild. Lagos. Thank you very much.
Thank you, gentlemen, and making it very simple for us to actually understand this morning.